Bismillah ar-Rahman ar-Rahim. Good evening, my dear vascular colleagues. I would like to speak today about a very important topic in the course of mastering vascular surgery. This topic is ACGME, vascular milestones. My name is Dr. Muhammad Amar Farouk. I'm a consultant vascular surgeon. Maybe a lot of you doesn't know what is vascular surgery milestones. This is a very important document by the Accreditation Council of the Graduate Medical Education that has been published in 2021. The aim of the document was to decide what are the vascular milestones that you would like your trainee to grasp and how you can assess them. So when you say that I have finished my vascular training, number one, you have to prove it with certificate, which is Certificate of Completion of Surgical Training, CCST, or similar equivalent in other countries, or you show from your tutor that you have acquired a high level, which is level 4 and 5 of vascular surgery milestones. The document is around 20 pages. It is freely available over the internet and also found on Vote Digital Library. The aim of the Accreditation Council is they have formed 29 milestones, which is very important for vascular trainee to grasp, between procedure skills, between patient safety, pre-operative management. There are 29 milestones. They think, and as this is absolutely correct, that you have to grasp these 29 milestones. When we put an exam, either in Egyptian board or similar equivalent exam, we always look into these surgical vascular surgery milestones. Questions comes from it. So you must know everything about this milestone. You must assess yourself, and your tutor give you an assessment to know how much do you really understand this topic, and have you reached completion of this topic or not. As I said, it has been developed in 2021, and they divide the level of the candidate into 5 levels. Between level 1, which is just a beginner, you know little bit of information about this topic, or the expert level, that you have grasped the level and you are fully aware of what needed to be done, and you can even have some ideas to improve science. Level 5 is really very difficult to achieve. But these 29 modules are very important for you to know, and you need to assess where you stand and how you can improve and how you can raise up your level. And there are many ways that you can do the assessment of these modules. Here is an example of these milestones. For example, the medical knowledge, intraoperative crisis management. This is a milestone. Any vascular trainee must know this intraoperative crisis management because it's extremely important and patient life depend on it. Level 1 and level 5. So let us say level 1, you can describe the potential of crisis during vascular training. If your level, you already understand this, then you will put a mark here. We hope after 6 months of vascular training, you reach into level 5, that you can describe, you can develop or publish innovative approach or otherwise impact patient care delivery of patient operative crisis management. So these are the square. In each level there is middle square, which means that you have grasped it in the middle of that level. When you go to that level, you have really achieved completely level 3 and you are entitled to enter to level 4. This sheet we usually do to assess our vascular trainee every 6 months with these 29 with 29 milestones, vascular milestones. Level 4, anticipate patient-specific risk crisis and describe appropriate treatment, algorithm, and potential outcome, including conversion to an alternative procedure. So I usually like our trainee to reach level 4 and 5, and they usually start by level 1. As long as they know that they are level 1, you need to go to level 2 and then to level 3. And this is extremely important. I will try to show you the document quickly. I would advise you to download it and to read it thoroughly. Now here is the document, and you can download it freely from the internet, Vascular Surgery Milestones by the Accreditation Council of General Medical Education. This is the definition of milestones, what we want from the milestones, how you assess your training. These are the members of the ACGME committee, and they will start here by mentioning how they have reached the milestones. And this is the diagram that we have discussed, comparing your level. And after that, you will go into these milestones. Patient care 1, which is patient data. This is very important. And medical management of vascular disease, again, between level 1 and level 5. So it's extremely important for you to know. I would get part of a lecture from Harvard Medical School about the vascular milestones and how you can assess them. I hope it will be helpful for you to understand. It's one of the very nice lectures that have been obtained from Harvard Medical School.
So it's a whole framework of knowledge, skills, and attitudes that are organized into a developmental framework from less advanced to more advanced. And again, these are specialty specific. You can find the ACGME milestones for your specialty, if you're interested, simply by typing into your search bar ACGME, milestone, and your specialty. And you'll see that trajectory of training. They are anchored in the 6 core competencies. There are descriptors for each level. And we really encourage our learners to familiarize themselves with the milestones because it's their roadmap. And it's how they can get from point A to point B in their training. Any questions on milestones? Each individual resident and each individual fellow, what we find in our own system and what is found nationally is in fact, each program has those few struggling learners that tend to take a lot of time and tend to take a lot of the committee's time trying to determine what is the problem. Is it a knowledge gap? Is it a professionalism problem? Et cetera, et cetera. And we call this problem identification models of our committee and of our evaluations. And what happens then is we don't spend as much time on all the learners, and we don't necessarily evaluate even our struggling learners on a developmental framework. Instead, it's like throwing darts at moving targets, just trying to understand what are 3 key problems, how can we address them, instead of what does even a struggling trainee look like developmentally on these milestones. And it's really because California has really led this, because of their honesty in sharing what they found across a number of training programs. There's been many more studies published, really agreeing with the fact that most committees are spending too much time looking at struggling trainees and still not feeling. This brings us just to the idea and the core concept around deliberate practice. how do we become expert at what we want to do? We have long looked at different professions that have done this so much better than we have. In music, in acting, etc. It's very common to have a coach. In medicine, it's much.
This is extremely important point that every vascular trainee must have a tutor or a coach or a moderator, someone to help him, to assess him across the way. This is the same scenario as in athletes, in singers. We should have the same. And this tutor should assess how you progress according to the milestone that we have discussed.
Less common to have a coach. That is changing, but it's a slow change. And this is a great article. It's in the lay literature. It's written by Atul Gawande. He's a surgeon in our healthcare system called Personal Best. And it's just a great story about what happened when he was about 7 or 8 years into his surgical practice, and he realized that no one was going to feel comfortable giving him the feedback he knew he needed in order to be the best surgeon he could be. So he asked one of his former mentors to come out of retirement and to sit in the corner of an operating room and to watch him operate. And then they had feedback conversations, and he writes about what went well, what he was proud of, but he also writes about it.
This is a very nice technique that you can ask your tutor, please come and see how I do this aorto by fem bypass or fem pop bypass or fem distal bypass. I'm doing it all right. What do you think? What can I improve? This is very important, and I always advise my junior to video with the assistant mobile, video what they are doing, their puncture, their angioplasty, their stenting. There is always room for improvement as long as there is meticulous observation of what your junior are doing. I hope in the future artificial intelligence will play a role, that you can have an AI in theater that will monitor what is happening, assess what is happening, and maybe improve the system, but we're a little bit far away from this point.
A major complication we had, and what it felt like to know that that feedback conversation was happening. This is available free on the web. It's a great read, and I would encourage you to read it, and maybe at an.
So in summary, I would like you to read this document fully, the ACGME document on vascular milestones. Know these 29 milestones. Try to assess your level or where you think you are, but it is always better for your tutor to do that. I'm very helpful. I would like to help you in this regard. If you contact me, I can contact your tutor and give him how he can do this assessment. You need to know where you stand. You need to know, have you really finished your milestones or not. So I think this is extremely important in grasping the vascular training and having the full confidence that you have finished your training. I hope this lecture is of benefit to you over your career, and over the next few episodes we will try to discuss the recent November 2022 aortic disease guidelines by the American Heart Association, and also we'll have a glimpse about what is happening with the Charing Cross meeting aortic Vienna, which was extremely interesting. I wish you all the best and see you next time.